Let's stay with that story. The UK Prime Minister Boris Johnson has outlined that country's plan to tackle the coronavirus outbreak. Johnson has also ordered the creation of extra mortuary spaces as deaths are expected to surge. For more on this, our UK correspondent, Oli Barrett, joins me now from London. So, Oli, straight up, let me start with that last bit of detail that I read in the intro there. Extra mortuary space because deaths are expected to surge. That doesn't sound good, does it?
Well, what the government is saying is that it is working out what to do in the event of various worst-case scenarios. It wants the public to be very clear on this. It is not saying that it expects thousands and thousands of deaths. It is saying that it wants to make sure it is as prepared as possible for this outbreak to get as bad as it possibly could do hypothetically. So those mortuary spaces represent part of that. We were hearing from the Chief Medical Officer and the Chief Scientific Officer for England earlier on, and they were asked about the potential in terms of infection, but also in terms of mortality. They were pointing out that this virus appears to have a mortality rate of around 1%. So most people will not die when they get coronavirus, if and when they do. The vast majority of people will have very mild symptoms and will make a full recovery. In terms of how many people could be affected in the end, though, the worst-case scenarios do suggest that a virus like this could hypothetically reach as many as 80% of the population. Now, the Chief Medical Officer and the Chief Scientific Officer saying it will probably be far, far below that, but they have to work on those worst-case scenarios. And if you were doing the maths on that worst-case scenario, 80% of a population of around 60 million here in the UK, if there were to be that many people infected and 1% mortality rate would be applied to that, that is hundreds and thousands of deaths. But as I must stress again, that's very much the worst case scenario here.
Crucial that you make that absolutely clear there, Oli. And I suppose it is a strategy that you plan for the worst case scenario so that you are able to, your response has maximum impact. But as things stand, where do we stand right now? Because previously when you and I spoke, we were speaking about people who contracted the coronavirus in countries elsewhere, particularly in Europe. I think it was Italy was one of the countries that we had mentioned. Where do we stand right now?
Well, that's right, and that's the other point that the government really wants to stress here. We are still at the stage where there are 51 confirmed cases of coronavirus in the UK. That really isn't very many. The government stresses at the same time it does expect that number to grow, and that's partly because of those geographical locations you were mentioning. Some of the newer cases in the UK have recently travelled to Italy, which does have a significant outbreak underway. And one of the real concerns now among health officials here in Britain is that it does become harder and harder to contain this virus when you do have people travelling around the country, but also having made international travel as well. So still only 51 confirmed cases. That means that the government's broad strategy at this point is still what it calls contain, which is to try and stop the virus spreading much further. But it is very clear that that may not be possible. We may get to the stage in the coming weeks and months where the virus is spreading really quite quickly, and that's when we will start moving on to the next phases of the government's contingency planning.
And in terms of the measures that are being taken under that tag of contain, what do they entail, both on the side of government but also on the side of other role players such as British Airways and Ryanair? I saw a report earlier on talking about what changes they are making.
Well, in terms of the contain phase that we are in at the moment, effectively what the government is doing whenever there is an individual case, it is putting that person into isolation, but also tracing their recent contacts to try and work out if there are other people who may have picked up coronavirus from the newest confirmed cases. So that is very much still underway. And then we have an education phase, really, when the government is saying the best thing you can do at this point is to continue to wash your hands often and well and for a long period of time. If we move on to those later phases, that is when other potential contingency measures will kick in. We're talking about things like school closures. We're talking about the government saying that the armed forces remain on alert if they do end up being needed. We're talking about the police being told that it might get to the point where they have to deal with only the most serious crimes. We might get to a stage where the National Health Service is saying some operations and treatments need to be delayed so that they can deal with the coronavirus outbreak. In terms of travel, you mentioned that there. The government health officials we were hearing from earlier at Downing Street alongside Boris Johnson were making the point that if we do get into a fully blown, widespread outbreak of coronavirus around the world, then at that point restricting travel won't make much difference at all. So it may even be that we go through several phases of this. We are seeing travel, for example, restricted back into China from Italy at the moment. There are some British organisations which are restricting travel to and from Italy as well. We may get to a stage in this outbreak where those restrictions get taken away because the outbreak has simply moved beyond that stage.
All right, Oli Barrett, thank you so much. Watching that story for us from London is ENCA's Oli Barrett there, giving us an update on the government plans and responses in as far as coronavirus is concerned. And Oli there emphasizing that the government is planning for the worst case scenario so that when the plan does unfold, perhaps they end up with a situation that's far, far much better than what they would have planned for.